And good morning. I'm Sean Cuellar. Winter has only just started, but there's already a flu epidemic in the U.S. It's our top story here on Midday. The Centers for Disease Control and Prevention says that the flu is now widespread in 36 states. It's also responsible for the deaths of 15 children, and it estimates that nearly 7% of all deaths nationwide were due to pneumonia and influenza during the week ending December 20th. So where's Oregon in all of this? Joining me live right now via Skype is Dr. Patrick Ludke with Lane County Public Health. Thanks for joining us here today, Dr. Ludke. What about flu cases here in Lane County? How many have been reported so far?
So we report influenza cases in a paradigm of 5 different reporting terms. And right now we're on sporadic, which means we're only seeing a little bit of flu here and there. No large increases in Oregon. So
very different compared to the 36 states impacted now with the epidemic. If someone does get the flu, we know that Tamiflu is an option. Who qualifies for this treatment, and is it really effective?
Tamiflu can be effective if given early. It's not a panacea, unfortunately. You've already had the infection, and the infection will play out its course, but it can be effective as a treatment by decreasing the severity of the symptoms and perhaps decreasing the total length of time that you're sick. But it doesn't stop the virus in its tracks. We sure wish we had a medication that did that.
Now, the CDC is still reporting the flu shot not very effective this year, but health officials, I know there at Lane County Public Health, is encouraging people, including children and also seniors, as well as adults, to still get the shot. Why is that message? Why has it not changed?
So the vaccine has several different flu viruses in it, and one of them is not a very good match this year. But the others in the vaccine are a very good match with what is circulating. So if you were to get H1N1 infection right now, the vaccine, had you received it, would have probably prevented that infection, or if you did get infected, would prevent a severe infection and hospitalization. So we wish it was a perfect match for all of the flu A and flu B viruses circulating, but at least it's a good match for a couple of them.
Right. And final question, here it is, we're going on January 1st tomorrow. Is it too late to get that flu shot?
Oh my gosh, no, it is not. The flu season lasts well into the spring, and typically our peak in Oregon is late January into February. And we have perhaps an early peak this year, but my gosh, there's a lot of flu season ahead of us.
Indeed, it is cold and flu season. Well, thanks so much for joining us today here on KEZI 9 News Midday.